I hope you're all doing well and welcome to another vlog. I am actually fresh from my 4th night shift, so pasensya na kung medyo bolol. At the same time, kung medyo stress looking ang jelly beans nyo. But I just can't wait to shoot this vlog and share with you the things I wish I knew before working in intensive care unit. And I think for the next couple of weeks, I will be sharing with you the things I wish I knew. So if there's something now you would like us to talk about or discuss, you can comment in the comment section and maybe that's gonna be my next topic for my next vlog. So for this series, we will be naming this as Joy G Talks. So just the background, I don't have any ICU experience sa Philippines. So I was working as a respiratory nurse. So the only time na I can visit the ICU is when a patient is intubated and it's on the ventilator, or if the nurse looking after the patient has questions with regards to the ventilator setup or its setting. So yun lang, hindi talaga siya bedside and not really patient facing. So when I came here, I really don't have any idea how to take care of critically ill patients, especially yung mga nasa ICU. So I was deployed initially sa pulmonary unit ng trust namin. But since COVID came, the ICU team needs backup, needs workforce. So lahat kami ng mga bago from Philippines and India, lahat kami na deploy sa ICU. And then months after that, the ICU matron asked us if willing ba kaming magstay. So kahit wala akong experience, parang I was so confident in saying na I'd like to stay. And I'm thankful na natanggap ako. Even now, I am really grateful to work in ICU. It's something na I never imagined to be. And I would say na it's also a dream come true. So, yun, all of these things na I'll be sharing with you today, it's purely based on my experience for the last 2 years na I have been working in ICU dito sa UK. So, let's start with number 1. I'm just gonna grab my notes, sorry. I'm all over the place, so sorry. Okay, so number 1 on my list is, I wish I knew that I'll be encountering lots and lots of medications. Way back in college, we have a subject called drug pharmacology, in which we are taught about the medicines, which diseases it's gonna be used for, what's its mechanism of action, its side effects, adverse reaction, nursing interventions, and drug preparation. But nung dumating na ako dito, I never, parang feeling ko wala akong na-learn ng mga medicines. Parang paracetamol lang yung alam ko. Kasi, mga foreign sounding yung mga medicines nila. Parang it sounded new to me. Parang wala talaga akong alam. Kahit nga yung epinephrine natin sa Philippines, they call it different here. They call it adrenaline. Norepinephrine, noradrenaline. It's just the same drug. Parang it's the same, it works the same. Yung pangalan lang talaga yung different. And also, the drug preparation, I am doing bank sa ward kasi. So, sa ward, they have a treatment room na they can prepare their medication, especially IV. But if POs, may trolleys sila, drug trolleys. But sa ICU, we don't have such. We prepare the medications sa bedside, sa katabi talaga ni patient. The reason for that is kahit na nag-draw up kami ng IV meds, our eyes should still be in the patient and in the monitor, ensuring na our patient is still okay, the obs are still okay. So, yun, that's something I wish I knew. Another one, number 2, is I wish I knew about protected breaks. This is something that really surprised me when I came, and it's something that I really appreciate. Kasi yung mga tao dito, pinupush ka talaga nila mag-break. There will always be somebody who will ask you if you have you been for break, or have you had your lunch na ba, or your dinner, or if you want a tea break. Para bang kahit pa sister mo or senior or kahit mga kabatch mo, talaga nag-a-ask sila sa'yo if you have been for break. Importante talaga dito na makapag-break ka para bang ikaw pa yung mapapressure if you haven't taken your breaks yet, kasi it's gonna affect the breaks of others. So you will not really be scared to leave your patient kasi the patient will never be alone. There will always be somebody to look after the patient. Even nga if I am in the middle of doing something, let's say I am drawing up bloods or I am getting vital signs sa patient, and there will always be somebody na ako na ang gagawa niyan. Just go for your break. Parang magmamakaawa pa sila na mag-break ka na. So, yun. Kasi sa Philippines, para bang if hindi ka nakapag-break, if hindi ka nakapag-lunch, kasalanan mo yun. Kasi wala kang time management. Pero dito, you always have that break. So, that's something na I really appreciate. And, the next one on my list, and I think this goes hand in hand with my number 2, is I wish I knew about the amazing teamwork in ICU. I never been to any ICU units in the country, but I would say na the teamwork sa unit namin is grabe, the best. You will never really feel alone sa shift. Like, there will always be somebody to help. There will always be somebody to ask if you're alright, if you need something, or if you need a hand. So, para bang the shift, maitatawid mo talaga ang shift kasi may maraming tao na tutulong sa'yo if you just have to say that you need help, which for me took a while to learn, because if you have watched my previous vlog, I'm really shy in asking help. So yun, parang ma-appreciate mo talaga na somebody's looking after you, your wellness, na parang hindi ka ma-stress. Hopefully, ma-lessen ang stress mo for the entire shift. Next up on my list is, I wish I knew how to be kinder to myself, especially when I was still starting. For the first couple of months, I was really intimidated with the machines, with the procedure, with the skills, because I have zero knowledge with it. And may mga tao talaga na mag-on the spot sa'yo if alam mo ba to. And then, para bang sometimes it will make you feel down na parang ang bobo mo, like hindi mo to napag-aralan, hindi mo alam. So I wish I would have learned this to be kinder to myself, because I was still learning. Like, these people are working here for 3 or 5 years, and here I am just very new, like 3 to 4 months sa trabaho. So, I was really harsh on myself during that time kasi parang pinapunish ko yung self ko na I have to really learn this kasi baka pagalitan or baka ma-on the spot ako, yung moral ko, like bababa na naman. So, I forgot to really enjoy and embrace the learning process, and we all have different ways of learning. Others learn through listening, through watching, or through observing others doing it, or sa YouTube maybe, or hearing it. So, iba-iba talaga yung mga tao. So, yeah, it's something na I wish I should have learned earlier para hindi ko nalagay yung self ko sa ganong level ng stress when I was still starting. So, if this is you who is starting, who is really under pressure and in so much stress because of her, try to be gentle with yourself. Baby steps. Take it one day at a time. Be proud of yourself because you have that initiative na that you're accountable and it's your responsibility to learn this and to unlearn some stuff na sa Pilipinas pa na it's not applicable here. So, ayun, those are some of the things I wish I knew before working in intensive care unit. And to be honest, I'm really grateful na I am working in ICU. Like, before pa sa Pilipinas, when I was applying sa hospital, the matron ba tawag? The chief nurse would ask you which area would you want to be assigned. I would always say I'd like to work sa emergency department, but deep in my heart, I wanted to do ICU. But I was just, parang sure, nag-off ko lang yung idea because I know it will never happen. But grabe si Lord, He made a way and He put me in this, He put me in this field na I really love doing. So, yun lang. So, I hope I was able to share something valuable to you, and I'm excited to hear you in the comment section on what's gonna be my next vlog and your thoughts about this vlog. That's it for today, Jelly Beans, and I wish you have a great day. Bye!